Now, in a patient with bicuspid aortic valve disease, there are 2 leaflets instead of 3. And the problem with 2 leaflets is that the eddy currents, the blood flow around those leaflets, are very different. And what can happen is that that leaflet can become damaged. And as a result of that damage, you get inflammation, which then heals with calcific scarring. And that calcific scarring leads to rigidity of the valve and ultimately a condition called aortic valve stenosis. Now, aortic valve stenosis can affect much older people in their 70s when they've got a trileaflet valve. But when you've got a bicuspid valve, aortic valve stenosis can happen a lot earlier in life, usually in the 40s. Now, another condition that can happen in patients with bicuspid aortic valve is floppy aortic valve leaflets because the connective tissue is weak. And in those patients, what we see is aortic valve regurgitation. And when that becomes severe and the heart starts to swell, you can become breathless, develop funny palpitations and heart rhythm disturbances, and you require either a repair or a replacement of that heart valve. Now, there's a third component to all of this, and that is the aorta. In patients with bicuspid aortic valve disease, there is also a weakening in the connective tissue of the early part of the aortic bulb, that very beginning part. We call that the aortic root. That aortic root can enlarge and become aneurysmal. So it's really, really important that if you've got bicuspid aortic valve disease, that some assessment is made of the aortic root to make sure you haven't also developed an aneurysm. And if you have developed enlargement of the aortic root and you need an aortic valve procedure, either a repair or a replacement, then depending upon the size of that aortic root, you may also require the aorta to be replaced at the same time.